Petting edema itu. This is dependent edema. ಇಲ್ಲಿ ಒತ್ತಾನ ಇಲ್ಲಿ ಡಿಪ್ ಬರ್ತದೆ, ಇಲ್ಲಿ ಒತ್ತಾನ ಇಲ್ಲಿ ಡಿಪ್ ಬರ್ತದೆ.
So good evening guys. Today we will discuss about concept of an edema. So in previous video you all are seen that this patient is having huge edema. So this may be this generalized edema is called as an anasarca. So what is meant by anasarca? Anasarca is nothing but generalized body edema. So it is dependent edema. It is called as like if it is for the leg, it is called as pedal edema. If it is for the hand, it is called as hand edema. If it is for the face, facial edema. In the same way, everything. So if the patient is having generalized body edema from head to toe, so it is called as anasarca. So in this video you have seen this patient is last stage of CKD patient who had developed generalized anasarca. So we'll discuss what are the major from smallest cause to biggest cause, like what are the basic from OPD to IPD cause. What we'll discuss each and every causes of the edema. So how to, like, for studying edema, so it is very important to study from the systematic wise. Like there are some edema means not only edema, it is some edemas are pitting edema, some edemas are non-pitting edema, and some edemas are dependent edema, some edemas are like local edema, like for the hand, for the leg and everything. So we'll discuss from each and everything. We'll discuss the causes from head to toe. So first we'll discuss from the eyes. So what are the difference, what are the connection between the eyes and the edema? So eyes are nothing but there are some condition like for in examination in the eyes for sclera or anything we will see for the pallorness. So pallor indicates anemic condition. So in anemia there are some edemas may be there. For in anemic condition there is some pleural, the patient of edema they will definitely have some failure features, CCF features may be there, because secondary cause the patient will develop some CCF features and patient will have edema. So if the patient is having HB is 12, there is normal. So if the patient is having HB 10, so in this patient they will never get some pedal edema and any edema. So if the patient is having huge like severe anemia, so that to chronic origin, because of the poor heart capacity they will develop some edema. So you just remember only one thing, like severe anemia patient may have developed that edema patient. So if you found in the OPD patient HB something patient, you have seen on patient that HB is 5. So patient is complaining of doctor I am getting some pedal edema. So you directly think maybe this pedal edema because of the low HB condition. So this is one more thing is in the throat. So thyroid disorders. In patient of hypothyroidism, there are some non-pitting edema, more probably in the leg also, and generalized edema may be there. In usually one thing is hypothyroidism patient will develop some edema, and after that there are some like renal failure. This is from up to here we have discussed. So first we'll discuss kidney size. So CKD patient they will have some pedal edema and they will have some all the edema. So why kidney will develop patient? Because there are some condition called protein losing nephropathy conditions. So what is meant by protein losing nephropathy? So this protein losing nephropathy seen in the CKD patients or nephrotic syndrome patient, they will lose the protein through the urine. Because of this condition, the patient will have the edema. So one more thing is we have discussed the kidney. So what is about the some intestine? Intestinal pathology will also cause some edema. So what are the pathologies that cause intestinal causes? There are some conditions for protein losing enteropathy. So what is meant by protein losing enteropathy? See in the long term, this is if the patient is of IBS patient, irritable bowel syndrome patient, and one more patient TBF, abdominal pox patient. So they will have 10 to more. This patient they will lose some protein through the like vessels. That's why this patient may have some edema. So this condition is called a protein losing enteropathy. And next thing is stomach. We are taking food and maybe less protein that will cause very rare condition that may cause some edema. One more thing is most important is liver. So any patient of alcoholic, that is CLA patient, more than if the patient is having liver cirrhosis and the chronic CLA patient more than 3 weeks, it will cause some edema. So this is liver pathology, because liver is the main organ which will produce the albumin. If the liver is damaged, there is no albumin. If there is no albumin, then definitely there will be edema. So we have discussed kidney, we have discussed intestine, we have discussed liver, and we will discuss some from the leg causes. These are the systematic causes, and some local causes includes, if the patient is having some arthritis, rheumatoid arthritis and everything, they will have some local edema. So that is only edema related to local. And just come to the above that foot, they will have some DVT. And one more thing is like DVT patient, they will also having some edema. And one more thing is varicose vein. So patient of DVT and varicose vein, they will have edema. And next one is filariasis. Filariasis means elephantiasis. So that is filariasis. This is a local causes of the edema. And we are having we discuss systematic cause of the edema and local cause of the edema. We'll discuss. From local cause of edema, there are joint arthritis will cause. Above that joint, there will be DVT and what is called as varicose vein. After that, filariasis, lymphatic blockage. After that, we will come to kidney disease, protein losing nephropathy, and we will come to intestine, salt or whatever protein or salt losing enteropathy. And one more thing is for the intestine, we have discussed IBS and TB to be rolled out. And one more thing is for the liver condition, we have to CL is definitely there. Only one we skipped is lungs condition. So lungs condition, there are some conditions, right heart failure. The core pulmonary patient, they will also having some pedal edema and edema. Core pulmonary means heart failure secondary to some COPD condition and lung pathology. So this is called as core pulmonary. This will also have produce some edema. And one more left heart failure. There is conjunctive cardiac failure. This is very, very important condition. Though this patient will definitely have some edema. So conjunctive cardiac failure, they will have some raised JVP, basal captations and bilateral pedal edema and breathlessness. That too on the exertion, and orthopnea they will develop, PND they will develop. If it is there, means this is left heart failure. So this all left heart failure. So these all conditions definitely will cause some pedal edema. So any patient if came to hospital, we have to rule out everything within a minute, because this is very, very important for the general practitioners and everything.